Little house cleaning, sorry folks. All right, where were we? We were on item number 6. All right. Presentations and selection for inmate medical services. This is an RFP that has been answered. Let me set the ground rules first before George starts. Each organization will be given 15 minutes for presentation. We will be abruptly stopping you at 15 minutes. So you watch the timer here a little bit in front of me, and we'll be watching the timer over your heads. So you will have 15 minutes to do your presentation. George, you have the floor now.
I need to start, Mr. Chair.
Sorry.
An opening comment to make. This will only take a second, but I would be negligent if I didn't mention this before he starts, because this is all about the jail. I do want the council to know that on the weekend of September 26th, the Association of Women Executives in Corrections awarded the Susan Hunter Endowment Award to Dr. Ford. It's a prestigious award, it's a $1,000 check, and as you know, Ms. Ford has been with the Division of Corrections since July of 1988, taken over the division in February 29, 2008. Actually, in addition to all of her other uses in managing the inmate population and saving us millions of dollars and making sure the place runs correctly. If you remember, when I was in need of leadership at the beach, she served as the interim division director, and I think in that position she established many of the procedures that we're using today. She was pushing for more accountability of staff, increased consumer service training, and updated the use of force training, and mentored a relatively young staff that really had endured several damaging incidents and intense negative press. She was there for us during the fire, before we got Mr. Swanson to come over. We couldn't be more proud of her. I do want to say, give her our congratulations, and we are well served by her in charge of corrections. Thank you, Marilyn.
Well, congratulations. Wow, I wish we would have known about that. We would have had you do a presentation earlier.
She would have begged off. I caught her by surprise. What I'd like George to do, obviously this is an important contract for us. I think for the sake of the community, George will give a few opening comments about what this contract provides. I do believe, Ms. Denny's is always on me about making sure that we advertise what we do. This is something that I do not believe we advertise very well. And in essence, we use $8 million of our general fund every year to provide health care, in this case to about 25,000 people that tend to be the poorest among us, in some cases the most damaged.
Actually, it's not advertising, it's telling the story.
Maybe that's the better way. Maybe telling our story. And so I do believe that a lot of people do not know that that money does in no way pay for the issues surrounding actually holding someone in court, incarcerating someone. This is both legally necessary but morally obligated, that we help people who are in pain, that are hurting, that have not had good health care. And quite frankly, in the jail population, unlike a prison, we get them off the street in the most damaged shape. In most cases, we either get them ready to go back on the street, or we get them ready to go to prison. But we do a lot of the stabilizing through this contract. It's extremely important. It's a big chunk of our general fund. And with that, George, take it away.
Good morning, George Rechtenwald, Director of Public Protection. Thank you, Mr. Chair, Honorable Council. Just a few brief words to kind of set the stage for today, then I'll turn it over to Janine Jennings, our Purchasing Director, to actually go through the process of the presentations and selection. Just wanted to hit on the fact, we're here today, of course, for the presentation and selection of the healthcare provider for our inmates. That's a 3-year contract with 2 one-year renewals. The 3 firms to present today will be Armor Correctional Health Services, Correct Care Solutions, and our current provider, Horizon Health. who's been with us since 2005. Just a little bit here. It's important, I think, to point out to the general public, jails are a little bit different than regular prisons, correctional institutions, because we have a very transient population. We're kind of the initial intake into the system, you might say. As the manager mentioned, we get them in all sorts of conditions, so it's important for us to make that distinction. The condition of our inmates can be literally off the streets where they've not had any health care. As the manager mentioned, they've been damaged. Typically, when one moves into a correctional institute, they've already been through a jail, and some of that work's been a stabilization and health care has been provided. In the last fiscal year of 12-13, as you mentioned, 25,000 individuals went through our correction division. And to get a flavor of our campus out there, we do have about 500 inmates that were convicted and sentenced. They're serving less than a year at our correctional facility. And at any given time, you also have about 1,000 inmates that are still pending court and in the jail. So it's important to remember that. Just to give a little bit of the workload that's out there, this contract, the way we bid it out, or the RFP we asked for, it would be in a base amount and then a specialty amount, because the base things, like a lot of things, are the maintenance items that we can count on. It's driven by population. And then there's the specialty items, which depends on the type of health conditions we run up against. So I just wanted to put some size to what we were talking about before we get started. Those base medical services, account for 68 intake screenings a day. Of course, all 25,000 people that go through there have to be screened. They have sick call and follow-ups that exceed that number. Of course, you have walk-in emergency evaluations. We have chronic care. People come in, they have diabetes, they have liver disease, they have issues, HIV, things that we have to take care of. They're chronically ill. Of course, a large portion of our population has mental health issues, and we need to address that. And you can see the size, over 56 people a day are seen on that alone. X-rays, EKG, dental work. And this is not, to be clear to anyone, it's nothing cosmetic. These are folks that are in need. They may have an abscess, they have a bad cavity. These are fillings and extractions type work. And of course, people coming to us and they are pregnant, and we provide that kind of care. So that's in your base medical, and that kind of gives you a size. The other part, which is always the hard part from a budgeting perspective, is to figure out what is out there in specialty care. So that's why the contract, as you'll see before you, and you'll probably be presented on, it'll touch in those separate areas. And of course, the number one thing for cost for us is hospitalizations. We had over 209. That's an average of 4 per week in the hospital. As we all know, any of us have relatives, have been part of that process ourselves. You know how expensive that can be. So it's very important that we have a provider that can work with our area hospitals and make sure that they're getting the best discounts and payment plans that we can have out there. Psych medications, again, you saw how many people we have in that category. It can be very expensive. Medications in general are something that's very important to us. How are they getting them, and what kind of systems will they be using to provide that? Physician referrals, you see how many there. These are your specialists, people with heart conditions, diseases and things that are over and above normal. And then we just threw in some of the other extra things that are outside the norm, ultrasounds and dialysis. You get an idea of the scope of work. And I just wanted to set that table as much for the public to hear that, to know what is in fact going on out there for prison medical as we go into these presentations. So with that, if there's any questions, I'll turn it over to Janine to actually get into the presentations of the various companies.
Okay, I see no comments or questions, so please continue. Ms. Judy.
Good morning, Janine Jennings, Director of Purchasing and Contracts. We have met earlier this morning with each of the respondents. We have 3 respondents. They were notified also of the 15 minutes that they will have to present. They have also chosen, as a professional courtesy, that they will only be in here one at a time. The other 2 will wait while presentations are made. That was a decision made by the group. They were given the option to stay in here. We will do a random drawing to see who goes first. We will let that person set up. They will come in and do a 15-minute presentation. The next one will have 5 minutes to set up, and so on. After all presentations are complete, we will come back for a Q&A. They will be here. You can ask them any questions that you have, and at that time, once questions and answers are completed, I will hand out a ballot, and I will ask for a vote for our new inmate healthcare provider. This RFP closed on April 22nd, and as you know, this is a process C, which means you are both the evaluation and the selection committee for this project. And with that, we'll do a drawing to see who is first, second, and third. And number 1 will be Armor Correctional. So if they want to go ahead and start coming up and getting set. Number 2 will be Correct Care Solutions, and Horizon will be number 3.
And they're going to take about 5 minutes to set up? Okay, well, I guess we'll be waiting.
Mr. Chair, may I ask a question of staff while they're doing that?
Sure, staff, Jenny, Ms. Jenny?
And it's probably to Ms. Weaver or whomever. This process is going to take about 45 minutes of presentation.
About an hour.
Yeah, or an hour here. Can you retrieve for me for fiscal year 11, 12, and 13, the actual cost of the contract that we currently have in place with the base and the specialty and the inmate population at that time? So what I'd like to see for fiscal year 11, 12, and 13, the final numbers, the value of that contract.
I'm sure we have the total cost, whether we can reach the breakout in that time.
Total's good.
Okay,
Yeah.
doable.
Total's good for 11, 12, and 13.
Thank you.
Thank you.
All right, I guess we'll be at ease until they're ready.